Today, we unravel the story of Laurie and the patient in room 303, a patient who was already dead but refused to leave. Welcome back to Into the Depths of Mystery. Today's story takes us inside a hospital during the quiet hours of the night shift, where the hallways are empty, the lights are dim, and some rooms hold more than just patients. So turn off the lights, get comfortable, and let's take a deep dive into the mystery of a night shift gone terribly wrong. My name is Laurie, a 25-year-old nurse, freshly graduated and just beginning my career. Like most new nurses, I worked endless back-to-back night shifts. I used to believe night shifts were calm and uneventful, just quiet hallways and sleeping patients. I don't believe that anymore. A few months ago, we admitted a new patient, Mr. Scott, a 70-year-old man with severe kidney complications. His condition was declining rapidly. We were doing everything we could, but every nurse knew it was a hope that was fading fast. He was quiet and barely conscious. He rarely had any visitors, no family, no friends. Maybe it was just my assumption. Maybe I never saw anyone because I only worked nights. One evening, I started my regular night shift. It seemed calm, fewer patients, and minimal emergencies. I checked each file, completed my rounds, and everything looked normal. Then the red light on my panel flared. It was room 303. I headed down the hall. I expected a call for pain relief, maybe a bed adjustment. But when I pushed the door open, I got shocked. Mr. Scott was meant to be completely bedridden. He couldn't move without assistance. But there he was, sitting up straight in bed, leaning against the headboard, looking directly at me. I was honestly surprised, maybe even a little thrilled. Was he getting better? He just looked at me. He had this unsettling clarity in his eyes. And then he told me, he called me, because he just wanted to talk. I realized I'd never actually talked to him before. He was always sleeping or unresponsive during my checks. He patted the edge of the bed and asked me to sit down beside him. For some reason, I felt uneasy. I couldn't explain it, but I wasn't comfortable. Something felt fundamentally wrong, so I politely refused. I told him I was fine standing. He insisted again, but I stood my ground. And then he just stopped looking at me. He turned his head slowly and stared out the window into the darkness. No expression, no movement, just this vacant, fixed stare. After a few minutes of that absolute silence, the atmosphere in the room felt heavy, suffocating. I mumbled an apology and backed out. I quietly left the room and returned to the nurse's station, trying to focus on my work. After some time passed, the call bell rang again. It was room 303. I took a deep breath and walked back to Mr. Scott's room. When I stepped inside, my heart sank. He was still sitting in the exact same position, upright on the bed, facing the window, staring into the darkness outside. He hadn't moved, not even slightly. I gently asked, "Mr. Scott, are you okay? Is there anything I can help you with?" No response. The silence in the room felt heavy, almost unnatural. Trying to calm myself, I said, "Okay, I'll sit with you now. You can tell me what you wanted to say earlier." I took a step closer. That's when he slowly turned his head toward me. He looked straight into my eyes and smiled. Then, without saying a single word, he turned back toward the window and continued staring outside. Something about that smile made my stomach drop. I didn't wait any longer. I quietly left the room and returned to the nurse's station, my heart racing, trying to convince myself that exhaustion was playing tricks on my mind. For the next 2 to 3 hours, I didn't receive a single call from room 303. I started to relax just a little. Then, around 4 a.m., the call bell rang again. Room 303. At that point, I was exhausted and frustrated, but I still got up and walked back to the room. As soon as I entered, I froze. The bed was empty. Mr. Scott was gone. No patient, no movement, nothing. Panic rushed through me. I immediately called a code, my hands shaking. Another nurse arrived within seconds and asked me what had happened. I explained everything. How Mr. Scott had been calling me all night. How he sat up, stared out the window, and tried to talk to me. She looked confused. Then she asked, "Are you talking about the patient from room 303, Mr. Scott?" I said yes. "He's been acting very strangely tonight." Her face went pale. "That's not possible," she said quietly. "Mr. Scott passed away yesterday evening. His body was already removed from that room." I felt the blood drain from my face. I told her that couldn't be true. I had seen him. I had heard his voice. He had looked right at me. She walked me to the computer and pulled up the records. There it was. Time of death, 5:45 p.m. I checked the patient list again. His name was gone, but I remembered clearly. When I started my shift, his name was still there. I don't know what I experienced that night. I don't know who or what I was talking to. All I remember is that Mr. Scott said he wanted to talk to me. And to this day, I still wonder what would have happened if I had sat beside him when he asked me to. I don't have answers, but even now, whenever I walk past room 303, I feel a sudden chill run down my spine. It feels like someone is still there, waiting for me. That's the end of tonight's story. If you enjoyed it, don't forget to like, subscribe, and join us again for more chilling stories.